Hello and welcome to McLaren Port Huron's Today's Health Program. I'm your host, Michelle Baker. Today we'll be talking about hip pain with board-certified orthopedic surgeon, Dr. Scott Heithoff. Dr. Heithoff, thank you for speaking with us today.
Thank you for having me here, Michelle.
Now, a lot of individuals as they age are faced with a lot of normal aches and pains, but what are some challenges that people face specifically related to hip pain?
Well, as people get older, even some younger people, they can start to have pain in their hip. Sometimes they may feel it in their back or on the side of their hip or the front of their hip. And a lot of times the challenge is that they can no longer do the activities they care to do. Things like golfing, even walking, or doing household chores become problematic for them.
So in this show, we're going to talk a lot about the hip joint. So can we start with an overview of the anatomy of the hip?
Sure. We'll take a look at a graphic here of a normal hip joint. So when we're looking at the hip joint, the hip is basically a ball and a socket, and this diagram shows the ball and the socket. At the end of the ball and lining the socket is a thick, smooth cartilage, and when the hip moves, that's what's rubbing against each other is the cartilage. It's also surrounded by numerous muscles and ligaments as well.
Now, what are some common causes of hip pain?
There are quite a number of causes for hip pain. We frequently will see people with tendinitis or inflammation of the muscles and tendons around the hip due to a lot of activity. Muscle sprains and strains are quite frequent. And also arthritic processes like osteoarthritis around the hip. Sometimes even low back pain or a bulging disc in the back can cause hip pain.
Now let's begin with osteoarthritis. What causes that?
Osteoarthritis is essentially wear and tear arthritis, meaning that over time the normal cartilage starts to wear out. And this graphic demonstrates that. This is that hip diagram that we looked at earlier. In this cartilage you can see is nice and smooth. When we look at an arthritic joint with osteoarthritis, that cartilage is no longer smooth. It becomes roughened, it starts to wear, and that's what causes pain in the hip.
Now we hear a lot about rheumatoid arthritis as well. How does that differ from osteoarthritis?
Well, rheumatoid arthritis is more of an autoimmune disease. What that means is that the body is attacking itself. And it's different from osteoarthritis is that it can be at any age when you get rheumatoid arthritis. And typically rheumatoid arthritis is diagnosed with blood tests and some other criteria, where osteoarthritis is diagnosed with x-rays.
Is osteoarthritis more prevalent than rheumatoid arthritis?
Yes, most patients that have hip pain or arthritis will be osteoarthritis. The rate of rheumatoid arthritis is a lot lower, but it still persists.
Now, what is traumatic arthritis?
So when you hear about traumatic arthritis, what we're talking about is damage to the joint from an injury, whether it be a car accident, a sporting accident, something that damages the cartilage during that accident. And then over time, because of that cartilage damage, the joint begins to wear out.
Doctor, this is great information. We need to take a break. We'll continue in a moment.